Hello and welcome. Today, we'll be discussing Spina Bifida, a complex birth defect that affects the spinal cord. We'll explore what it is, how it happens, and what can be done to manage it. Spina Bifida literally means a split spine. The exact cause isn't always known, but it's believed to be a combination of genetic, nutritional, and environmental factors. A key factor is a deficiency in folic acid, also known as vitamin B9, during pregnancy. However, even with sufficient folic acid intake, Spina Bifida can still occur. Certain medications taken during pregnancy, maternal diabetes, and obesity may also increase the risk. During the first few weeks of pregnancy, the neural tube, which eventually forms the brain and spinal cord, should close completely. In Spina Bifida, this closure fails to happen fully. This incomplete closure leaves a gap in the spine, potentially exposing the spinal cord and nerves. The severity depends on the size and location of the opening. This exposure can lead to nerve damage, affecting motor function, bowel and bladder control, and other vital functions. Spina Bifida affects approximately 1,500 babies each year in the United States. While advancements in prenatal care and folic acid fortification have helped to reduce the incidence, it remains a significant health concern. The prevalence varies across different populations, potentially influenced by genetic and environmental factors. The signs and symptoms of Spina Bifida vary widely depending on the type and severity of the condition. Some individuals may have no noticeable symptoms, while others experience significant disabilities. Visible signs may include a sac or lesion on the back, tufts of hair, or a dimple in the skin over the spinal defect. Symptoms can include muscle weakness or paralysis in the legs, bowel and bladder control problems, hydrocephalus fluid build up in the brain, seizures, and orthopedic issues like scoliosis or hip dysplasia. Spina Bifida is typically diagnosed during pregnancy through prenatal screening. Alpha-fetoprotein, or AFP, screening is a blood test performed on the mother. Elevated levels of AFP can indicate a potential neural tube defect. If the AFP test is positive, further testing is performed, such as ultrasound imaging of the fetus. Amniocentesis, which involves analyzing amniotic fluid, can also be used to confirm the diagnosis. After birth, a physical examination and imaging tests like rays, CT scans, or MRIs can further assess the extent of the condition. There are several types of Spina Bifida. Spina Bifida occulta is the mildest form, often without any visible signs or symptoms. Meningocele involves a sac of fluid protruding through the opening in the spine, but the spinal cord itself is not usually affected. Myelomeningocele is the most severe form, where the spinal cord and nerves protrude through the opening in the spine. This can cause significant neurological deficits. Treatment for Spina Bifida is complex and often requires a multidisciplinary team of specialists, including neurosurgeons, orthopedic surgeons, urologists, and physical therapists. Surgery may be needed to close the opening in the spine, often performed shortly after birth. Ongoing management focuses on addressing specific symptoms and complications. This may include physical therapy, occupational therapy, assistive devices, bowel and bladder management programs, and shunt placement for hydrocephalus. The goal is to maximize independence and quality of life. While Spina Bifida cannot always be prevented, taking folic acid supplements before and during pregnancy significantly reduces the risk. Healthcare providers typically recommend that women of childbearing age take 400 micrograms of folic acid daily. Women who have had a previous pregnancy affected by a neural tube defect may need a higher dose, as prescribed by their doctor. Maintaining a healthy weight and managing pre-existing conditions like diabetes can also help lower the risk. The prognosis for individuals with Spina Bifida varies greatly depending on the severity of the condition. With comprehensive medical care and support, many individuals with Spina Bifida can live full and productive lives. Recent research is focused on improving surgical techniques, developing new therapies for neurological deficits, and exploring regenerative medicine approaches to repair damaged spinal cord tissue. Fetal surgery, performed before birth, is also being explored as a potential way to reduce the severity of some forms of Spina Bifida. Research continues to advance our understanding of this complex condition and improve the lives of those affected.